Welcome to H&HN Daily. I'm Susanna Hopsolin, Senior Editor for Hospitals and Health Networks magazine. Ineffective communication between caregivers is the leading cause of medical errors in hospitals. At UPMC Mercy in Pittsburgh, nurses are using smartphones to receive alerts on a change in a patient's condition or urgent patient orders, and to facilitate communication among staff and with patients. Today, I'm joined by Kevin Vandermeer, Senior Systems Engineer, UPMC Mercy, to discuss using smartphones on patient units. Welcome, Kevin.
Thank you.
Thank you for joining me today. How does the smartphone work on the nursing unit?
Well, basically, we have smartphones on all our nursing units, and when the nurse comes in the morning, they pick up one of the smartphones, they log in, and then they do their patient assignment right there on the phone, and from then on, they receive alerts and messages throughout the day about their patients. Any kind of alerts regarding transport or telemetry alerts, they all come right to that phone.
And did this replace a lot of the other technologies that they were previously using?
Yes, initially we had just landlines and the pagers and shouting up and down the hall. We didn't have an effective communication system. So when we brought the smartphone in, we were able to eliminate pagers, free up landlines for physicians and other people, and really help our communications and our patient safety throughout the hospital.
How were the nurses involved in the design of these processes and the system?
We involve the nurses by having a monthly user group meeting. So IT and nursing sit down every month and we discuss what things they would like to see on the smartphones, what things we can design for them, and IT kind of helps them figure out what these devices can be used for. It's basically a computer on your belt, and we want to show them that it's much better than any other wireless phone that they can use.
What turned out to be of most value to them, would you say?
I would say definitely the alerting and the amount of time that we save them looking at the computer. They would, because of CPOE, they would have to go check the computer several times throughout the day looking for orders and seeing if there's any stat orders. A physician can put an order in anywhere in the country. They don't have to be in the hospital. We alert the nurse when there's an order. We don't want to tell them everything on the smartphone because the screen size is limited. So what we do is we just alert them that there's an order there that they can go and check. It saves them the time of looking for that order.
And this had an effect on transport services also. Could you describe that a little bit?
Yeah, actually we handed out our smartphones to our transporters and integrated it a little bit to their transport software, and we immediately saw a 10 to 20% increase in the amount of transports each person could do per day.
And what about patients? How did patients react to this?
Well, we didn't really poll the patients, but what we did is we put in the patient handbook, and we also put throughout the hospital posters saying that you'll see your caregivers carrying these smartphones. You'll be able to take better care of you, spend more time at the bedside. We also put the information, like I said, in the handbook to kind of alert them that they weren't talking to their husband or wife on the phone. They were actually doing patient care on that phone. And
are there things that you have in the works for the future?
Absolutely. We're constantly inventing new things, especially with this user group. One of the newer things we've just implemented is a program called Chat. We haven't put a text plan on all of these phones. There's no text plans, so what we did is we implemented our own texting system. So we wrote some software we call Chat, where the nurses can basically text each other without a texting plan. And all of those texts are logged in a database, and what we do, we don't log them to be Big Brother or anything, but what we do is we log them to see if we can any of those text messages so that they don't have to type them all out. They can be in drop-down lists. Some other interesting things, we just met a month ago and they suggested a NIH stroke scale that they'd like to see on the device. So I wrote an app for them where they can actually do the NIH stroke scale at the bedside on the smartphone rather than dragging a card into the room or whatever. They can do that right on their smartphone and then take it out and document it later. Another exciting one that I'm actually working on right now is a wander risk program where they can, any kind of patient like an Alzheimer's patient who potentially could wander off campus, they could take pictures of them, log them in a database, and then security in seconds can send that picture back out to all the BlackBerries in the entire hospital so that we can track down that lost patient much more quickly.
Thanks for joining us today.
Thank you.